After getting out of my vehicle, I'm going to first determine if the scene around the patient is safe. I will do this by looking for any hazards to the patient, to myself, my partner, or the bystanders at the scene. After figuring out that the scene is safe and that there are no hazards, I'm going to make sure that I am wearing my personal protective equipment. This includes gloves, as well as a mask, gown, and eye protection in some scenarios. After I have my personal protective equipment on and I have made sure that the scene is safe, I am then going to approach the patient. I will be able to tell if I need the help of additional resources such as fire, police, hazard control, or any other public services, as well as advanced level providers, which I do not in this scene. I will then be able to determine if the patient has a mechanism of injury for trauma or a nature of illness for medical. Based on the information from dispatch as well as the bystanders at this scene, it is determined that this patient is a trauma patient. Therefore, this patient has a mechanism of injury, which is due to the fall that they endured. I am then able to look at the patient and determine how many patients there are at this scene, in which case there is only one. I am then able to determine if the patient is stable or unstable. In this scenario, the patient is sick and unstable because they are unconscious and unable to respond to me as I enter the room. This patient is approximately 16 years old and is a female. Since this patient is a trauma patient, I will then advise my partner to hold the manual stabilization of this patient's cervical spine. My partner will hold the neck and the head of the patient in order to limit movement of the spine as I continue my assessment. I am then going to look for any immediate life threats to the patient. These would be illnesses or traumas that would have happened that would need immediate care in order to prevent the death of the patient, in which case there are none in this scenario. I am then going to continue my assessment of the patient.